Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Dr. Thompson. Thanks for seeing me on such short notice.
Good morning, Robert. Not a problem at all. Please take a seat. I'm Dr. Lisa Thompson. Now let's discuss what's been bothering you.
Well, I have been feeling really tired recently, and no matter how much I rest, I don't seem to feel any better.
I see. That sounds challenging. Have you experienced any other symptoms along with the fatigue?
Yes, I seem to be out of breath often, and my heart races even when I'm resting.
All right. Have you noticed any changes in the color of your skin or eyes, perhaps a paleness?
Indeed, my wife remarked that I look paler than usual. She's the one who insisted I come to see a doctor.
It's good that you came in. Have you experienced any dizziness, headaches, or lightheadedness?
Yes, especially when I stand up too quickly. I feel really dizzy and lightheaded.
Have you been taking any medications or supplements? Maybe something over the counter?
No, not really. I try to avoid taking medication unless absolutely necessary.
I understand. How about your dietary habits? Are you eating a balanced diet?
I've been a vegetarian for years. I try to eat a balanced diet, but my appetite has decreased lately.
Noted. A decrease in red meat consumption can sometimes lead to low iron levels, contributing to anemia. Have you experienced any issues with your digestive system?
I have experienced some discomfort and bloating, yes.
Robert, I would like to understand a bit more about your background. Can you tell me about your family and work?
I am married with 1 child, a 5-year-old daughter. I work as a software developer, mostly working from home.
Do you have any recent travel history, especially to areas with poor sanitation or where malaria is prevalent?
No, I haven't traveled out of the country in a couple of years.
Great. Can you share some details about your general health and lifestyle? Do you smoke or consume alcohol?
I don't smoke, and I rarely drink, maybe a glass of wine occasionally with dinner.
That's good to hear. Now, moving on to your family medical history. How is the health of your parents and siblings?
My parents are generally healthy, though my mother has type 2 diabetes. I have a brother, and as far as I know, he's healthy.
I see. Given your symptoms and lifestyle, it would be prudent to run some tests to rule out anemia and understand your overall health better. This would likely include a complete blood count to look at your red blood cells, hemoglobin, and hematocrit levels.
That makes sense. I just want to understand what's happening and hopefully feel better soon.
Absolutely, Robert. We'll make sure to get to the bottom of this. I'll have my assistant set up the necessary appointments for your tests. Once we have the results, we can discuss the appropriate treatment options and any lifestyle changes that might be helpful.
Thank you, Dr. Thompson. I appreciate your thoroughness and look forward to resolving this issue.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I've been struggling with itchy, red, and inflamed skin lately. I believe it's eczema.
Good morning. I'm sorry to hear you're experiencing this. Let's discuss your symptoms and medical history to get a clear picture. When did you first notice the symptoms?
It started a few weeks ago, but it's getting worse now. I have these rashes on my elbows and behind the knees.
Are you experiencing any other symptoms like blistering or oozing from the affected areas?
Yes, some areas are blistering and quite uncomfortable, especially at night.
How would you rate your itchiness on a scale of 1 to 10, with 10 being the most itchy?
I would say it's around 8. It's very irritating and keeps me awake at night.
Okay, have you tried anything to alleviate the symptoms so far?
I've been using over-the-counter hydrocortisone cream, but it hasn't helped much.
All right, let's discuss your medical history. Do you or any family member have a history of allergies, asthma, or other skin conditions?
My mother has hay fever, and I had asthma as a child.
Have you been exposed to any new products, substances, or environments that could have triggered this reaction?
I haven't changed my detergent or skincare products, and I haven't been to any new environments lately.
What about your diet? Have you introduced any new foods recently?
No, my diet has been the same for quite some time.
How many times do you bathe or shower a day? And are you using any specific soaps or body washes?
I shower once a day and use a mild, fragrance-free soap.
Good. Eczema tends to get worse with harsh soaps and frequent washing. Are you currently on any medication?
I am on antihistamines for seasonal allergies.
Given your history and symptoms, this does seem like eczema. Ideal management includes avoiding triggers, keeping the skin moisturized, and managing symptoms. However, since over-the-counter treatments aren't working, you might need prescription medication. Topical steroids, calcineurin inhibitors, or other anti-inflammatory creams can be effective. In some cases, a course of oral steroids might be necessary.
What would be the next steps, doctor?
I'll need to run some tests, including blood work and possibly a skin biopsy to confirm the diagnosis and rule out other conditions. After that, we can discuss a detailed treatment plan, including lifestyle modifications, skincare routine, and medication. It's also important to manage stress, as it can exacerbate eczema.
I appreciate your help. Let's proceed with the tests and formulate a plan to manage this condition.
Excellent. Once we have the test results, we'll meet again to go over your tailored treatment plan. Keep the affected area clean and moisturized until then, and try to avoid scratching as it can lead to infection.
Thank you, doctor. I look forward to resolving this issue soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Could we discuss the gentleman in room 204 with bipolar disorder? He has been quite aggressive.
Yes, he has a history of severe mood swings and erratic behavior. Before his admission, he was managing his condition with medication and therapy, working as a software developer, living a fairly structured life. His current state, confined and under observation, is a drastic change for him.
He has been resisting medication and showing hostility towards staff. How can we ensure his cooperation for treatment?
It's a challenge, but his aggressive refusal isn't indicative of a refusal to live. When he communicates, he often speaks about his projects and programming languages. It's indicative of his normal life. It's crucial to keep him engaged and provide a structured environment, resembling his regular life as closely as possible.
Now look at question 26.
Unfortunately, we will have to reschedule Mr. Thompson's angioplasty. It can't be performed as planned.
Wasn't he the one who had his procedure delayed previously, pending clearance from pulmonology for his lung condition?
That's correct. He was cleared eventually when his lung function was deemed acceptable. However, he has reported some new concerning symptoms. I wish he had called earlier to discuss them rather than waiting until now. He was optimistic it wouldn't impact the procedure.
How did he react to the news?
He was understandably frustrated initially, but understood the necessity of resolving any potential underlying conditions before proceeding with the heart procedure.
Now look at question 27.
So, it's essential to manage your blood sugar levels with a proper diet after you leave. Have you any questions or any dietary preferences you'd like to discuss?
I think it's clear. But you mentioned avoiding sweets and sugary drinks. Can I have diet sodas?
Do you consume a lot of diet sodas?
Occasionally. I usually prefer them over the regular ones.
In moderation, they are a better option than sugary sodas. However, water is the best choice. And about meals, are you okay with including more lean proteins and fiber-rich foods?
I suppose I can manage. Just to confirm, I can use artificial sweeteners in my coffee, right?
Yes, but moderation is key. Over-reliance on artificial sweeteners isn't recommended.
Now look at question 28.
The assessment from our recent review on patient mobility sessions was enlightening. We performed exceptionally well in conducting sessions, ensuring patient comfort and documentation. However, our management of post-session pain needs improvement.
So, what should we do to address the issues in managing post-session pain?
We should be more vigilant about monitoring patients' pain levels and responding promptly with suitable interventions. Are we all clear on the pain scale and the corresponding interventions?
I think a quick refresher on the interventions for each level of pain would be helpful.
Absolutely. I will arrange a short training session. Additionally, regular follow-ups to assess any late-onset pain after the sessions are crucial, and always ensure that the patients are well informed about the possible discomforts and the ways to manage them.
Right, that makes sense. And ensuring our patients are well informed will also make them more cooperative during the sessions.
Now look at question 29.
This is John Doe, admitted to the ward yesterday evening following a severe motor vehicle accident resulting in a traumatic brain injury.
Understood.
He was immediately taken for a CT scan, which showed a significant bleed. The surgical team placed an intracranial pressure monitor to keep track of any potential swelling, and he's been administered medication to manage the pressure.
All right.
Now, on day 1 post-admission, we'll be closely monitoring his neurological responses and vitals, ensuring the medication is controlling the swelling and keeping him stable. It's crucial to prevent any secondary injuries and complications due to increased intracranial pressure. He's still under sedation, and we need to be vigilant about any changes in his condition.
I see. So regular neurological assessments and close monitoring of vitals are crucial.
Exactly. And we also need to maintain a conducive environment to prevent any sensory overloads. Any disturbances can affect intracranial pressure.
Now look at question 30.
MRI machines are invaluable for non-invasive imaging, providing detailed pictures of the inside of the body, which can be pivotal for diagnosis and treatment planning.
We often use them for spinal and brain abnormalities, but their application is vast, covering almost every part of the body. The accuracy and details they provide are crucial.
Absolutely. But acquiring accurate images depends largely on proper patient positioning and correct parameter settings. It requires understanding and knowledge to differentiate between normal and abnormal anatomy, to ascertain what we're observing.
When I was in training, differentiating between the myriad shades of gray was daunting. It took substantial practice and learning to discern the subtleties. There's increased emphasis on this in the current curriculum, but real-world experience is irreplaceable.
True. So any doubts or queries on the proper utilization and interpretation of MRI images?
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good day, everyone. My name is Dr. Michaela Waters, and I am a public health specialist primarily focused on infectious diseases and vaccination programs. Today, I'm here to discuss the impactful work involved in controlling and preventing rabies, a viral disease transmitted through the bite of an infected animal, typically affecting mammals. To elucidate the real-world implications of rabies, I will share the story of a patient, let's call her Jane, and her encounter with a possibly rabid animal. Firstly, I'd like to provide some background on rabies. This zoonotic disease is fatal once symptoms appear, and it is thus crucial to seek immediate medical attention after exposure. Annually, rabies leads to approximately 59,000 deaths worldwide, predominantly in Asia and Africa. The majority of these cases originate from dog bites, making canine vaccination and public awareness paramount in rabies control efforts. Now on to Jane's experience. Jane, an avid hiker, encountered a raccoon acting erratically during one of her adventures in a remote woodland area. Unbeknownst to her, the raccoon's strange behavior was indicative of rabies. Jane was scratched by the raccoon, and though it seemed minor, it posed significant risk due to the potential for viral transmission. Initially, Jane hesitated to seek medical advice, underestimating the scratch's severity. When Jane finally consulted a healthcare provider, immediate action was undertaken. She received a series of post-exposure prophylaxis, PEP injections, a critical measure in preventing rabies development. The anxiety and stress experienced during the wait for her treatment to conclude were overwhelming for Jane, highlighting the emotional toll such encounters can induce. Jane's story illustrates the diverse reactions individuals may exhibit post-exposure to potential rabies carriers. Some, like Jane, may underestimate their risk, delaying crucial medical intervention, whilst others may experience significant anxiety and stress due to potential disease development. These psychological aspects necessitate a compassionate and informative approach from healthcare providers to alleviate fears and ensure understanding of treatment protocols. Moreover, the consequences of not adhering to treatment plans can be dire. A failure to complete the rabies PEP regimen can result in the virus progressing to the nervous system, where it becomes almost universally fatal. This demonstrates the importance of clear communication and follow-up to guarantee treatment compliance, especially considering the potential adverse effects or misconceptions related to rabies vaccination. The various preventative measures available, including animal control, vaccination, and public awareness, all play pivotal roles in rabies mitigation. Balancing these approaches while addressing individual needs and concerns poses unique challenges to healthcare providers. In this context, community-based health initiatives become invaluable, allowing more personalized and continuous support for exposed individuals. By fostering relationships with patients, providers can more effectively address concerns, clarify misconceptions, and ensure adherence to life-saving treatments. It's our belief that smaller, more focused health clinics, as seen in community setups, allow for a more personalized and responsive approach compared to larger impersonal hospital settings. These community clinics can play a crucial role in addressing the multifaceted challenges posed by rabies, from prevention to post-exposure treatment. Our ongoing initiatives aim to enhance the availability of such community clinics and expand public awareness on rabies, promoting prompt and appropriate responses to exposures. By bridging knowledge gaps and ensuring access to crucial medical interventions, we hope to contribute to the global effort to eliminate rabies-related deaths.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Scabies is an incredibly transmissible skin infestation caused by a tiny mite known as Sarcoptes scabiei, a microscopic menace that affects millions across the globe. The infestation leads to severe discomfort, primarily through incessant itching that can disrupt everyday life. I'd like to illustrate the overlooked aspects, implications, and management strategies of scabies and how the healthcare community and public can work together to combat this condition. Scabies often doesn't receive the same level of attention as other infectious conditions, potentially due to its association with poor hygiene, leading to stigmatization and underreporting. However, it's essential to understand that scabies can affect anyone, irrespective of socioeconomic status or personal hygiene levels. The mites are incredibly contagious and can spread rapidly in crowded environments such as schools, hospitals, and long-term care facilities. The classical manifestation is an intensely itchy rash, particularly at night, appearing predominantly in the interdigital spaces, wrists, and waistline. Without prompt treatment, the condition can escalate, causing secondary bacterial infections and, in severe cases, systemic complications. Individuals with compromised immunity, the elderly, and the malnourished are more susceptible to a severe form known as crusted scabies, where mites multiply in millions, creating thick crusts on the skin. This form is highly infectious and requires aggressive management and stringent infection control measures. Breaking the cycle of transmission is crucial in managing scabies. The healthcare sector needs to heighten awareness about the contagious nature of scabies and educate the public on preventive measures. Emphasizing the importance of early diagnosis, proper treatment, and preventive strategies, including thorough washing of clothes and bed linens, can significantly reduce the spread. Treatment usually involves topical or oral medications, with permethrin cream and ivermectin being the most commonly prescribed. However, treatment needs to extend beyond the infected individual to all close contacts to curtail the transmission chain effectively. Public awareness about completing the treatment course and environmental decontamination is pivotal. Management of scabies requires a multifaceted approach involving healthcare providers, patients, and the community. Early detection and appropriate treatment are paramount, but equally important are community education, destigmatization, and preventive measures. Consider John, a 45-year-old man with no significant past medical history, who started experiencing severe itching, especially at night. Despite maintaining impeccable personal hygiene, the symptoms persisted, leading to sleep disturbances and impacting his professional life. Eventually, he visited his GP, where a detailed examination revealed the presence of scabies mites. John's case illustrates how anyone can contract scabies, irrespective of their hygiene practices. His adherence to treatment and proper decontamination measures, coupled with public health advice on preventing transmission, was crucial in his successful recovery. Furthermore, his experience underscores the importance of destigmatizing scabies, promoting community education, and fostering a supportive environment for affected individuals. The scabies mite doesn't discriminate based on age, gender, or socioeconomic status. A collective effort to understand the condition, its implications, and the significance of early diagnosis and management can go a long way in controlling scabies outbreaks and reducing the morbidity associated with this condition. The enhanced and targeted public health messaging, community participation, and cross-sectoral collaboration between healthcare providers, policymakers, and communities can foster an environment conducive to the effective management and eventual eradication of scabies. It's high time that we bring this silent affliction into the limelight and address it with the urgency and diligence it warrants.